Hi, we've just finished Workshop 3 here in Albany, Western Australia, the Great Southern region. This is one of the best regions in the country for pulling people together, young people, non-government organisations, the higher education sector, the police, the ambulance, the youth services, coming together to focus on improving mental health and mental health services for young people. They've contributed to the model, they've made it real, they're working with us, and I'm very confident that they'll take it forward, actually use the tool to have a big effect. They've got the right people, local government, PHNs, health services, and their overarching framework of compassionate communities. They're people who really care, but they're also people who want to do.
What I got out of today again was the general passion of everyone that's involved in this. But importantly, what we saw was the outcome of all the contributions made by our young people, our clinicians, our community members who came along to each of these workshops over the past year and provided that information, which has now actually been turned very efficiently by Sydney University into a really feasible tool. And I think very exciting out of this is the concept of actually having an economic aspect to it too, because there's a tool to use when you're actually talking to government and funding bodies about really positive outcomes for young people. This will be a tool that will actually be evidence-based and will show the difference.
The wonderful thing about the model we've been discussing is to really highlight the impact we can have on the mental health of young people. We have focused on the things that really matter to this community and the things that we think are the right decisions for us that will really have a meaningful impact to our young people.
So from my perspective in the public mental health service, obviously funding is a huge issue, and getting a seat at the table for some of these funding of special projects can be quite difficult. So I see that this model will be immensely important in the work that I do in workforce development, in getting some of these projects off the ground. Just being able to see that it's not a singular impact and it's not a singular this siloed approach that we've been working with in mental health, that we really need to work together as a community and have that connectivity and have that, that cohesion across working together as a community. And the economic benefit isn't just money. We have so many interwoven parts that come into this, so I think it will just be an incredibly invaluable tool that I wish we could expand across all of our regions.
I'm really excited to see how the tool's going to help us with our decision making when it comes to planning for the future directions of youth mental health here in the Great Southern. I think we haven't really had a tool that enables so much data to be modelled to help guide really nuanced decision making.
As a young person myself, I think it can make or break something, and it's giving that extra evidence, that extra understanding of that things can change and not just these short projects that come and go, but something that we can invest in for the long term.
The thing that strikes me about the tool, and it's something that strikes me lots to do with mental health, is nobody actually thinks about where the value is created. Value is created at the clinic, at that interface between a practitioner and a person in need. And I think the tool does that. It's one of the few tools I've seen where that central focus is on the micro systems of care, not this great macro system. And it connects the two. It connects the practitioner who generates the value with the individual to the bigger system, rather than the reverse, which is this kind of top-down models, which look great on paper, but rarely deliver value.
From the way forward perspective, it's very much about keeping this fire alive and actually working very hard to make sure that as a compassionate community, which the City of Albany is already, we want to make sure that this is a success and that we continue to build on it. And over the next couple of years, with our ongoing relationship with Sydney University, we really want to kick some big goals and actually show that what they've done is actually turning into some really positive outcomes for young people.
I think the sustainability piece is key. We can have all the intent in the world, but unless we follow it through with action, for me, it's about breaking down those silos that we've seen across mental health in particular, across all public health sectors. We've always worked in a very siloed approach, and we understand that there are moving parts within the system, but we've never really had an opportunity to see how those parts can interact and how playing nicely in the sandpit together can really benefit everybody, and have some nuts and bolts things to to influence policy, to be able to influence economics. I think the sustainability piece is really around the continuity of getting these people in a room and having us all contribute with an equal voice. So it doesn't matter whether you've got lived expertise, whether you've got a doctorate, whether you've come from an economic background, everybody's voice is equally important, and I really see that here.